Welcome to this course, Awareness of Nursing Goals from Revolve Staffing. This course is focused on foundations for safe, effective, and patient centered care. It aims to bridge the gap between theoretical knowledge and clinical application, ensuring that care is not just task oriented, but personalized, respectful, and safe. Why do nursing goals matter? Nursing goals provide a clear framework that guides every clinical decision and intervention toward improving patient outcomes and quality of care. They ensure care delivery remains safe, respectful, and consistently aligned with evidence-based professional standards and best practices. And finally, understanding these goals empower nurses to prioritize effectively, make informed decisions, and advocate confidently for their patients' needs. Let's start by having a quick overview of essential goals that every nurse must be conversant with. 1. Patient safety. Nurses must prevent harm through constant vigilance, risk assessment, and strict adherence to safety protocols and evidence-based guidelines. 2. Patient comfort and dignity. Respect individual needs, preserve privacy, and ensure physical and emotional comfort throughout the care journey. 3. Clear communication. You should endeavor to always facilitate accurate, compassionate information exchange among patients, families, and the entire healthcare team. 4. Teamwork. Always work towards collaborating seamlessly across disciplines to deliver coordinated, comprehensive, and efficient patient-centered care. And 5. Adherence to care, plans, and policies. Follow evidence-based standards consistently while remaining flexible to individual patient circumstances and needs. Now let us discuss these 5 essential goals one after the other. The first is patient safety. We like to call it the non-negotiable priority. Nurses serve as the patient's primary safety advocate, often being the first healthcare professionals to detect subtle changes in patient status or early warning signs of complications. For example, early recognition of sepsis indicators, such as elevated heart rate, temperature changes, or altered mental status, can initiate rapid intervention protocols that dramatically improve survival rates. In order to ensure patient safety, the following daily safety actions are important: rigorous medication verification and double-checking, strict infection control and hand hygiene practices, full risk assessments and preventive measures, and continuous monitoring and documentation. The second essential goal is comfort and dignity of the patient. This is essentially about humanizing care. Taking time to explain procedures in plain language, adjusting room temperature for patient comfort, or ensuring adequate pain management demonstrates genuine care and enhances the healing environment. Respecting cultural traditions, religious practices, dietary preferences, and personal values preserves patient dignity and builds therapeutic trust between nurse and patient. Examples of how a nurse may dignify their patients include using patient-preferred names and pronouns, providing privacy curtains during care activities, explaining before touching, and honoring modesty concerns during examinations and procedures. Another core nursing goal is communication. This is the lifeline of nursing care. Clear and concise handoffs, teach-back methods, and effective advocacy are all elements of effective communication. Structured communication during shift changes using standardized tools like SBAR prevents critical information loss and reduces medical errors. SBAR stands for Situation, Background, Assessment, and Recommendation. Situation is a brief summary of the immediate problem, patient name, and unit. Background includes pertinent history, diagnosis, admission date, and recent lab results. Assessment entails your professional analysis of what is happening, including vital signs and clinical findings. And recommendation will include the requested action, intervention, or plan to address the situation. Teachback methods involves asking patients to explain instructions in their own words so as to ensure true understanding and identify knowledge gaps before discharge. Clearly communicating patient concerns and clinical observations to physicians ensures timely interventions and patient-centered decision-making. Teamwork and collaboration is the fourth essential goal we will be discussing. Endeavor to actively participate in regular team meetings involving physicians, nurses, therapists, and social workers, as they are opportunities to improve care coordination, reduce duplicate efforts, and ensure comprehensive treatment plans. Also, Take advantage of avenues that may be available in the facility for more experienced nurses to guide newer colleagues, sharing knowledge, and providing emotional support as this strengthens team resilience and improves patient outcomes. Also, participating in monthly team debriefs to share clinical insights, discuss challenging cases, and collectively problem solve care delivery obstacles help towards achieving better outcomes. The fifth and last goal we will be discussing is professionalism and adherence to standards. This includes upholding nursing codes of ethics, organizational policies, and regulatory standards. This builds trust, ensures accountability, and protects both patients and practitioners. In addition, engaging in ongoing professional development, staying current with evidence-based practices, and pursuing certifications enhances clinical competence and decision-making quality. You may also maintain reflective journals to process challenging situations, recognize personal biases, develop emotional intelligence, and build professional resilience. As you go about your daily tasks, it is important that you are able to link these tasks to nursing goals. Note that every action matters. Routine tasks from vital sign assessments to thorough documentation directly support overarching nursing goals and contribute to optimal patient outcomes. Also, using clinical judgment to rank tasks based on patient acuity, urgency, and individual needs, as well as applying critical thinking skills to recognize when patient conditions change and been flexible regarding adjusting care plans to address evolving clinical needs ensures effective, efficient, and safe care delivery. In conclusion, in order for you to achieve these nursing goals, you need to 1. Embrace daily awareness. Make goal-conscious care a habitual practice in every patient interaction and clinical decision throughout your shift. 2. Advocate with purpose. Communicate patient needs clearly, collaborate intentionally with colleagues, and speak up when safety or quality concerns arise. And 3. Create safe environments. Together, we build healthcare settings characterized by safety, compassion, respect, and excellence in patient-centered care. Let's commit to nursing with intention and heart. Thank you.